Hello and welcome to Natural Healing with Oriental Medicine. I'm Grant Boxleiter and I'm joined by Dr. Stephen Wrench of East West College of Natural Medicine. We're going to be talking about the practice of Moxibustion. Right now, though, I'd like to send it out to the president of East West College, Russell Badiata.
Thank you, Grant. Thousands of years ago, in the cold climates of northern China, diseases and painful syndromes caused by cold were prevalent. The burning of certain types of wood, it was learned, brought about relief when placed in close proximity to painful or specific areas in the body. One type in particular had the most amazing effects on cold and pain. Artemisia vulgaris, a member of the chrysanthemum family, which burns at an extremely high temperature but does not combust, is today known as Moxibustion. It rids the body of cold pathogenic influences, improves circulation, and reduces pain.
Thanks, Russell, and we'll be checking back with you later when we see a demonstration of this in action. But right now, Dr. Wrench is here, and on today's program, we're going to be discussing the practice of Moxibustion. For those who may not be familiar with how this all works, where did it come from, and just give us a real sense of what this is.
Okay, Grant. Well, first of all, Moxibustion it's a medical practice derived from traditional Chinese medicine. And we'll talk in a little bit about how this came into being. But it's basically the burning of a very warm therapeutic herb, which is held near specific points on the skin and generally moved about or sometimes placed in a stationary manner for the purpose of expelling cold from the body when we have cold syndromes, for the purpose of moving energy around the blood, dispersing swelling and masses and things, and warming what we call collaterals or channels in the body. It's
so
also
if a patient is cold, what could be causing that would maybe prompt this treatment?
Well, there are a number of things. Basically, and not to get too technical or too involved, but cold is one of the pathogenic influences that make us feel less than 100%. We have what we call exterior cold invasions when cold, like when we catch a common cold in the wintertime and so on. Then we have what we call full cold or interior cold syndromes. So sometimes we have patients who say, I'm always cold and I can't get warm, or people that live in a cold climate. And the Chinese, for as far as we know, the oldest civilization on the planet, have been exposed to the cold for centuries, so they've had a lot of experience at dealing with cold and cold-based syndromes. So let's just take a simple cold. When you live in the northern province of China, you experience cold a great deal of the time.
It's very cold up there.
And so they learned early on that what is the antidote to that, and it's heat. And so what we needed is sitting by a fire doesn't always do it. Putting on extra clothes doesn't always do it. So what they discovered was that there was a certain herb that we now know by its botanical name as Artemisia vulgaris, simply put, a member of the chrysanthemum family.
And does this grow naturally all around the world or just in China?
Well, it does grow in other places other than China, but if you ask the Chinese, the best herbs are grown in China. And so, but it is now grown in the States and all around the world. But it's a specific plant that is harvested, and it's turned into, and if I may show you, there's a little bit of this. We just brought a little baggie full of what we call loose moxa. And if you kind of want to just feel this, it feels a little bit the consistency of like dryer lint, but it has a very golden color. This is a very good.
And does it separate, or is it meant to be kept together like this?
Well, just like you did when you squeezed it together, we build little cones out of this.
I see.
And as you'll see later in the program, when Dr. Fuller is actually treating a patient with moxa, he designs a little cone, and he makes it just about the size of, I would use the example of one of these little Hershey Kisses, about that big, like a little mound. And it's placed on specific points on the body, and it's literally lit. Now this is what we call direct moxa, which means moxa that is placed directly on the surface of the skin. And so the problem with that in a clinical setting is you have to stand there and watch it burn.
You have to make sure.
Oh yeah.
There's safety precautions, I'm sure.
And it gets hot, and it gets a little hotter and a little hotter, and you want to keep it always to tolerance. Then it has to be removed, and another cone is placed on the same spot.
So if you're doing that, let's say you're doing it on the hand, I don't know exactly where you would place it. I guess it would depend.
Sure.
But would each one before you had to replace it with another mound be just a couple of minutes, or?
Depends on the size of the mound. Really, it's only more like a matter of seconds.
Oh, seconds.
So let's say 10 to 20 seconds. I think you'll see later in the program, actually I know you will, Dr. Fuller my colleague will be burning the herb on the surface of the skin on a point on a young lady's leg, and you'll see he'll leave it on for a few seconds and remove it very quickly as it does get hot. Now, certainly there's a risk there, but I will tell you, interestingly, in some Asian countries, we have what we call direct moxa. In some Asian countries, for thousands of years, they believe by placing this little mound of moxa on a specific point, it's actually better to let it burn down until it blisters the skin and then remove it. Now,
So is that the equivalent of a first-degree burn or a second-degree burn?
more like a first, just a little bitty redness or a little blister. Now, in this country, we look at that a little bit like, excuse me? So, we don't do it a great deal at the college, if at all, except more in the teaching vein, because there's so many other ways to apply moxa. But it was done for the purpose of, when an acupuncture point is stimulated with a needle, the point is, as we've talked in past programs, is literally switched on. Well, when the body has a little, let's say a little blister, even though it's done on purpose, if it's done directly on a specific point in the body, that point remains switched on because that point is trying to heal itself.
So all your immune system in your body goes to that point. So if there's a blister there, the theory would be that your body is helping in some way.
Exactly. So let's just say we talk about our healing energy in the body, and let's just say it kind of congregates as if to say what's going on here. And by it being there in a healing sense, that area is stimulated longer. So we don't do it a lot in this country, but it is done a great deal in Asian countries. It's called scarring moxibustion. And there's an old expression, especially in Japan, if there's a point on the leg here we call a longevity point.
Just below the knee?
Yep, yeah, okay. It's called a longevity point. And there's an expression, burn moxa every day, and the point is called Zusan Li, and I'll just give you the Chinese. Zusan Li. Burn moxa every day on Susan Li, live 100 years. And there's actually documentation to prove that people that do this regularly and religiously do actually enjoy a longer, healthier life.
They become a centenarian.
Yes, in a sense. It's not guaranteed, but it's a strong possibility,
yes,
right?
They certainly have some anecdotal evidence anyway.
Yeah, for sure.
And they believe in it directly. So indirect and direct moxibustion.
Yeah, now indirect moxa, and we're going to show you one of the different forms. Let me first show you another form, and this is very small, and I don't know if our viewers at home can see it. I'll hold it up. It looks, I always say it looks a little bit like
like part of a pen almost, like inside or something.
Yeah,
but maybe
it's about the size of a little candle you'd put on a birthday cake, cut short. And there's a little paper base here, and then there's this little darkened resin area, what we would call like the candle part. And this has a sticky base. So we would place this on the surface of the skin, and I'll put it here on my lab coat so you might see it.
Okay.
And then we would light this, and it would burn down just to where you see the paper beginning. And then it will smolder a little bit. The beauty of moxa is it does not combust. It will never burst into flame, but rather it'll smolder, and it's like a hot red ember, like maybe a charcoal if you cook out in your backyard. So this will be like a little burning ember, and it'll burn down.
And this will stay burning for a minute or two?
Exactly. And then this is removed with a little hemostat because they get hot. You don't want to grab them and take them off.
Right.
We've all done that, and regrettably. And so this would be replaced again and again until we have done this for several minutes on whatever point we're treating.
Very fascinating. And don't go away. When we come back, more questions with Dr. Wrench, and then we'll go back to the college to see this procedure up close.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back to Natural Healing with Oriental Medicine. I'm joined by Dr. Wrench. And Dr. Wrench, you brought some samples here when we're talking about moxibustion. I want to touch on a few other things that you have sitting here in the studio.
Sure.
What is this?
Well, this is actually a what's called a Moxa box.
Okay.
And it's kind of strange looking actually, but we actually use these rarely. But let's say we want to apply Moxa to like your low back, and
Okay.
you're on the table and you're in a prone position. We can actually set this on your back, and we can take the lid off of this.
So on your lower back probably?
That's
or-
correct. And if
okay.
you notice within this, it's got a little screen in the bottom of it.
Yeah, I see.
Right.
And
so we would put the lid on this, and what we would do is we would configure a hard Moxa stick into the top of this box, or just even drop it in.
so this is one of those sticks.
Yeah, now we talked before, we showed you about direct
This-
Moxa, and we showed
Right.
you that we had a little tiny candle effect. Then we showed you that we have the loose Moxa, it looks like the dryer lint.
We have, and this is much
Yeah.
bigger now.
Yeah, so here's a big version. Now the difference is, I might mention here, that the Moxa that we showed you in the bag here,
Yes.
that kind of looks right like golden dryer lint, for lack of a better term,
Right.
and it feels like it.
That you haven't emptied in a while, right?
Yeah, that's right. So that's an example of direct Moxa. It's placed directly on the skin. The little candle that we had, the little miniature of
Right.
this, by the way, these are a hardened version where we take this and it's refined into like what would be a very hard resinous material. And if we tap this on the table, you can hear it's very hard, like a piece of chalk, only not as brittle. This is,
Now, will this burn?
it will, and it's a little hard to light. This is called smokeless Moxa. Now, one thing about the loose Moxa, that when we're in a treatment room with a patient and we light this, obviously it gives off, as you'll see later with Dr. Fuller, a little plume of smoke. This does not quite give off the smoke, but it does have an odor. It's not unpleasant
Does
at
it
all.
change color? Can you tell it's burning?
Only because you'll see the little red ember on the end.
Okay.
Now we'll tell you with a lighter or a candle, it takes a few minutes to get this lit. You can feel it's very
To
hard.
get it hot enough, yeah.
So it's very hard to light. Whereas another version I'll show you later is very easy to light. So they all have their benefits, but they're all pretty much doing the same thing. It's a matter of convenience or a little bit more work for the practitioner.
Is it preference? Do you
It
get
is.
used
It's
to
a
using a different method? Or
It is, let's say that you're in your office all day and you're burning smoke, the type that creates a smoke, and it's permeating your practice all day.
Right.
It can get a little difficult to breathe, even though that in
even
and of
if you're
itself is
ventilating.
therapeutic.
Right.
Yeah. But without proper ventilation and constantly moving that air, it gets a
it
little
can get a little
old.
overwhelming.
This particular type, the smokeless Moxibustion, doesn't give off the smoke, so it's preferred a lot of times in our clinic. Now we have what we call these are all, by the way, methods of indirect. These will never touch the skin, but if my hand were in pain or something,
But
I
you'll
would
feel
move
the
it.
heat,
Oh,
right?
absolutely. And you bring it close enough so that the patient controls the temperature all the time. So this looks like a
So they're in constant communication with the person
absolutely.
administering the procedure.
You have to be, because you always want them well within their comfort zone.
Yeah.
So we would like, now this one looks like kind of a, we might call
This
it
is
a,
almost like a Roman candle.
It looks
from
like
the
one,
4th of
right?
July, a small one.
so we would light this, and again, now this one would smoke like crazy, but we
Right.
would hold this near the pain, let's say of carpal tunnel, and we're holding it near and moving it around, as you know, keep it moving, it's not going to get so hot. The patient feels the comfort of it, and we go, are you comfortable at this distance? I'm fine, it feels really good. Then we'll just move it very slowly throughout the region for several minutes. If there's another point, we'll go to that
So
point.
carpal tunnel is an approach, or if someone is diagnosed or is feeling the symptoms of that,
Absolutely.
Moxibustion is certainly something that can be administered to try to help.
Oh, certainly. We use Moxa a lot for pain relief, but it's also used, as we said, for cold syndromes, for certain.
What about arthritis when
Absolutely.
you talk about pain?
Yes, but with certain limitations. One thing we want to think about is putting heat on a fire in Chinese theory is not always a good idea, as you can imagine.
Yeah.
So if we have a certain kind of arthritis, like a rheumatoid, where there's a heat involvement, even though in China it's not uncommon for them to do that, there's a time limit that you don't want to go beyond because you don't want to exacerbate a condition.
Right. Now, how did the Chinese discover the therapeutic use of this plant?
Well, as Dr. Brandon Fuller will tell you again later in the program, I'm just going to I don't want to repeat everything he says, but basically, and there's different schools of thought, and I think he took a little different tact. It's kind of a folklore thing, so I'll give you an example. But let's go back to northern China 5,000 or 6,000 years ago, and we live in our little hut, and we've got our little kettle, and we've got a little fire in there.
It's cold outside.
Absolutely. And of course, in that time, as is very common in China, the parents and the kids and the grandparents all live together.
Yeah.
And in that time, particularly. So let's take grandma, and she's got the arthritis in her hands and everything, and they're working outside in their fields, and they're either tending to agriculture, they're fishing,
Yeah.
they're working hard, working on the rice crops. Their hands are wet and cold a lot. So what are they doing, Grant? They're warming their hands by the fire.
Right.
And what do they send the kids out to do is get more firewood.
More firewood.
So one of the theories is that the kids go out and they start gathering twigs and kindling, and they bring it in, and it never really bursts into flame, but it does smolder. But it gives off a tremendous heat, and incidentally, this burns at 670 degrees, and it's a very dry heat. So what that's good for is deep penetrating heat. Back to grandma, she's got her hands around the pot, and she's got her hands right around this little kettle, and she's warming her hands. The next day, she's looking at her hands, and she says, you know what? My hands haven't felt this good in years. And then later she goes, I wonder if there's a connection. Where did you get the wood that you burned in the kettle last night? And the kids go, well, usually we just go over here, but yesterday we went down the hill and we found this little bush, and we broke some of the twigs off. And she goes, go back down the hill and get more of this, this
great
type,
stuff.
Right? This was a member of the, as we said, the chrysanthemum family, and it's called mugwort or Chinese wormwood.
So this is basically a plant that has some stems.
Oh, yes.
And some things that.
Oh, it's actually like a little shrub, right? And so now it's grown, and the best stuff still comes from northern China, but it's in many different forms. And I didn't really touch on.
Can you grow this in greenhouses, and is it in controlled
Absolutely.
environments? So it'll grow anywhere.
Yes,
I
yes,
assume.
it will. It's pretty hardy. So now we talked about taking one of these sticks, placing this little moxa on the back of a patient while they're prone and they're not moving, dropping a lit moxa stick in here, and there's a little screen in here.
Just letting the heat
So it
emanate.
keeps it up off their body at a very comfortable distance, and we just place this lid on top. It's a little chimney.
And the
smokes.
hole just kind of helps it aerate.
Absolutely. So this is another. While this isn't used a great deal, it's a convenient
You still have
method.
it at the college.
We absolutely do. And so again, now we have our direct and our indirect moxa. One of the benefits of this is, as I said, it expels cold from our channels.
Right.
In Chinese medicine, our channels are little super highways that traverse the human body, along which we know for a fact that healing energy travels, just like electricity through the walls, through the wiring. So our energy traverses these meridians that we call them. When cold attacks meridians, there's always pain, there's always discomfort. It's always a bad thing.
Is it like a roadblock for
exactly.
the highway?
We back the cars up on the interstate, nobody's happy.
Right.
So when we get pain invading a channel caused by cold, it's always a very severe pain. And this is one of the things. Now we can go home and put a heating pad on it, but that's not. It's therapeutic in one sense, but it isn't deep penetrating.
Right.
In all the years this has been around, it's the only herb they've ever found that does what it does.
That's fascinating. All right, so let's now go out to East West College of Natural Medicine and see a treatment using Moxibustion with Dr. Brandon Fuller.
All right, so we're back here at the campus where we're about to demonstrate Moxibustion. Take it away, Dr. Fuller.
Thank you, Russ. So Moxibustion is an herb that is processed and burned over the body. What it does is it brings in this warmth and this warm nature and blood flow to the area when burned over specific areas. So as we talked about previously, this herb was found thousands of years ago up in the cold mountains of China. And what had happened was the Chinese, they were foraging and they came across this bush and they put it on the bush. And when the bush caught on fire, the old man that was standing around it went, ooh, wow, that feels kind of nice, right? And he noticed that the aches in his hands and in his joints went away, right? And so he told his grandchildren and his children, where'd you get that? I need you to go get more because I don't hurt when I feel that, right? So Nowadays, we use things like Moxibustion, and what I've done is I placed a little bit of cream on Amanda's legs here, and it's burn cream so that there's no incidences, and it'll help just reduce any burns that may be created when we do loose moxa. So what we do is we have this smokeless stick. It's highly compacted Moxibustion, and we heat it up and we just do it over the area. We don't actually touch the person with this stick, and it just brings a nice warmth to this area, and it helps keep this entire area warm. So as we put this warmth, you would be able to see a slight redness on her legs, which would occur underneath this cream. Also, we use loose moxa, and loose moxa is a wonderful tool for when we need to use it for needles or to warm specific acupuncture points. So you can take loose moxa, you can place it directly onto an acupuncture point, and then you just light it on fire, right? What I'm going to use is a little incense stick, and the incense stick will help so I don't have to place fire right near her leg. So this will burn, and it'll focus that heat directly onto the point, right? One of the downsides to loose moxa, though, is the smell of it. The smell of Moxibustion is fairly strong, and it can create a smell that lingers for a couple of days, right? So loose moxa can be used continuously over a bunch of specific areas, right? So we might use loose moxa on specific points. We can use it on the abdomen to help with abdominal pain. We can also use just the smokeless moxa just on specific points. So if we want to warm fingers for somebody who comes in with arthritis or knee pain, we can specifically bring heat to that area on specific painful spots. It's perfect, it's wonderful, and I want to thank you for joining us.
All right, thank you very much, Dr. Fuller, and don't go away. We'll be right back with more.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back, and we just saw the Moxibustion procedure, Dr. Wrench, right there, and it was very interesting. And so if someone wanted to do this, it looks like it could be pretty easy.
It is. You know, in China, it's not uncommon when you visit your physician for them to give you a moxa stick and send you home and tell you how to do it. There's a little bit of a risk to this, though. There's certain times that we wouldn't want to do that.
Right.
For example, if someone has like what we would call diabetic neuropathy, where they have a loss of sensation, they can't feel the heat, they can get a blister. Also, when we have what we call heat syndrome.
So these are things that the patient might have that would prevent you from recommending.
It would be contraindicated, and it would be, for example, it's not done with high blood pressure, which in our parlance is a heat syndrome of sorts.
Right.
And it isn't done over broken skin or skin rashes, and in certain conditions. I will tell you one thing that's very interesting. In China, when a child is about to come into the world and they suspect the baby will be born breech, and they want to turn the fetus, they will light a moxastick beginning in the 34th week and apply it to a specific area on the foot. And they will stimulate this, and they'll have the mom do it or a member of the family do it, and it will almost without fail, it will right the fetus.
This goes unbreached, and
it will turn the fetus. And it's an incredible thing, and we've done it in the clinic before, and it's done a lot. Now in China, they'll go, here's your moxa-stick, good luck. We'll have you come to the clinic.
You'll actually supervise the procedure.
Oh, absolutely,
and,
yeah. It's a medical, as simple as it seems, you know, it's a medical procedure.
It's still a medical procedure that needs expertise, I would think. Now, as far as therapy involving burning herbs that we've been talking about today, are there complications such as dealing with the smoke you talked about earlier? It can get kind of smoky depending on how many procedures you have. Is there a risk to the patient? Do you kind of maybe time it out? Or?
Yeah, there are some. Again, ventilation is an issue, but it's not like you're walking into a burning building. It's not that bad at all. But we do. Some people are bothered by it. Other patients love it and ask for it.
It would seem that it's a plant, it's a burning plant. I mean, if you inhale enough smoke, I guess anything burning, it can be harmful. But it sounds to me like this is a pretty natural approach, and there's not really a lot of risk as long as you're not directly inhaling it for long periods of time.
Unless you're super sensitive to it, it doesn't bother most people. I've only heard probably 1 or 2% of the people are troubled by it. It's not like walking into, into a smoke-filled room like in the old days when everybody smoked indoors and things. It's nothing like that at all. It's actually breathing this in is considered therapeutic for certain conditions.
So would someone get these treatments potentially a couple of times a week?
They would. It's usually done as an adjunctive treatment to acupuncture. In fact, there's even a form I didn't bring, but we'll use one of these as an example, where we take we'll call a little moxa bud. It's placed on the end of an acupuncture needle and lit so that the heat, very, very mildly so, travels down the needle and stimulates the acupuncture point. Then these are lifted off and then replaced. And this is another method for moxa. So again, it's used as a pain reliever. It's used to disperse cold. It can be used for certain types of swelling and other maladies.
All kinds of things, and we're almost out of time, Dr. Wrench, but let's let folks know where they can learn more about Moxibustion or any other procedure at the college.
Sure, absolutely. We're on the South Trail, and we're right across the street from the Pirates Cove, the little
the
golf place there, right there on
golf.
41 near the airport.
Right in Sarasota.
And we've been in Sarasota 20 years. We have a clinic on the premises, and we feel free to call us at 355-9080. That's 941, of course.
Right, you have the number on your screen, the website.
Yes,
folks can go if we get more information. A great show today. Dr. Wrench, thank you, and thanks
you
for joining us. We'll see you next time.